We want to welcome to the program a gentleman who is an orthopedic surgeon, Dr. Jesse Morse, MD. Dr. Morse, welcome to the program.
Hi, how are we doing?
I'm well. I'm doing well. Thank you once again, and yourself.
I'm doing good. So first off, I am a sports medicine physician in Florida. I am part of a group of physicians and surgeons called the Fantasy Doctors, which have several different orthopedic surgeons and sports medicine doctors that cover and analyze injuries either in real time or briefly after, as it pertains to professional sports, usually the NFL, baseball, and sometimes college sports. But we'll cover any injury as long as we kind of know what we're looking at.
Let's just go over about the different injuries, sports. People still get kind of confused about the differences and the injuries and the tears and things of that nature. So explain to our audience what an ACL injury, what that is all about.
So the ACL, to break it down for you, and what I tell my patients here in clinic, is ligaments and tendons don't heal. Bones and muscles do. So if you break a bone, for the most part, they heal within reason. If you tear a muscle, for the most part, it heals. The issue with a tendon or a ligament is that it doesn't have a good blood supply and it doesn't heal. So tendons have a tendency to wear and tear. Ligaments just tear and that's it. So the ACL is a very, very important ligament in the knee. So the nature of the ACL is to prevent the lower part of your leg from collapsing forward. So with that being said, if you are running and you need to cut and go to the left or to the right, you need to hard stop and put enough force to be able to rotate and change your body's motion to whatever direction you're going to. Well, all of that motion and all of that momentum goes through the ACL. So without your ACL, you cannot run full force and stop on a dime and cut. You just won't have the ability to do it. We can have completely normal lives if you tear your ACL after appropriate rehab. But in order to get back to running and to get back to cutting and planting and feeling comfortable and stable, you have to repair the ligament. And traditionally, they'll use either the top of the kneecap, which has a tendon there, and sometimes they'll use the hamstring tendon for a lot of these pros. Those are the most common too. Unfortunately, there is very common, given the nature of these injuries, given sometimes the field conditions, and sometimes if they've had one in the past, they're at significantly higher risk for getting another one on the same side or the other side.
All right, let's tell our audience about the MCL.
Okay, so the MCL is probably the most common injury in the knee in terms of ligaments. So if you look at the knee from the front, you have a ligament going down the outside of the knee north to south. You have one going down the inside of the knee north to south, and then you have the crisscross in the middle. The crisscross in the middle is the ACL, along with what we call the PCL, which is rarely injured. The lateral aspect, or the outside aspect of the knee, is what we call the LCL, not commonly injured at all. And then the MCL is the ligament that runs north to south on the inside of the knee. So the purpose of the MCL is to prevent the knee from collapsing inward. So traditionally, this is injured very commonly in football. When someone gets tackled and their knee gets hit on the outside, we'll say it's your right knee, and your right knee gets hit and collapses inward. Well, in order to prevent that knee from fully collapsing, the MCL is there. Unfortunately, the forces are usually strong enough where you can strain or sprain that ligament. So think of a rope, and then think of kind of barely kind of irritating it. That would be a grade 1. Think of ripping that rope in half. So half of the piece is still there. That's a grade 2, and then in 2 pieces would be grade 3. So fully torn. And that's essentially what happens to a lot of these players. There's at least 1 or 2 players every week that suffer in the NFL that suffer an MCL sprain. Not overly concerning, but they do take time to heal.
Okay, and tell our audience also about the PCL.
So the PCL is the crisscross ligament with the ACL, predominantly in the back. Very challenging to injure. The problem with this is it's a very thick ligament, like the size of your thumb. So it's very, very strong, and it takes a long time to heal if you sprain it. Usually they do not do surgery on these, and you really don't ever hear about it as a result. But it is the counterforce to the ACL. It's the one that crisscrosses with it, and it does the opposite effect.
And also tell our audience again about another major one, the LCL.
So the LCL is not super common. It is the ligament that runs on the outside of the knee, traditionally only injured when the knee gets hit from the inside, which is uncommon because your other knee is next to it and usually close to it. But we traditionally hear of this usually accompanied by an ACL or a severe knee injury. Traditionally, these are very concerning because the posterolateral corner, which is the back outside part of your knee, has a lot of small ligaments and is very important. The only major LCL injury that comes to mind, at least for football, is Carson Wentz when he tore his ACL. There was rumblings that he also had an LCL sprain and posterolateral injury, and those are a very big deal. So these take a very long time to heal because of how important that part of the knee is. Thankfully, it's not common, so we don't really worry about it.
All right, good job as always, Dr. Morse. So now let's talk about something that you continue to do with sports injuries in your practice. Tell our audience a little bit about the podcast and also how detailed you go into in terms of explaining these injuries.
The Fantasy Doctors podcast itself is a weekly recording every week during the NFL season, usually on Thursday nights, when most of the injuries for the week are available and we have more clarity. And it usually drops late Thursday night, early Friday morning. And that is usually a 45-minute to hour, depending on the week, discussion with a fellow sports medicine doctor that basically we break down each injury, each major injury, and discuss the importance of it and whether or not we're concerned about it and how that player is going to play as a result of this injury or whether or not they're going to play and how it will affect them. That's basically the Fantasy Doctors in a nutshell, and people have a tendency to benefit from that because it gives them an idea of A, is this player going to play, and B, how effective will they be, and who else should I look at if they're not playing. And we do that weekly throughout the whole season.
So now tell our audience, Dr. Morse, current projects that you're working on.
We have several of the other guys do a weekly NBA podcast to kind of keep people up to date with that. I'm more of an NFL guy, so I keep my head in the football, but there is an NBA podcast that you can listen to. There's also a MLB podcast that they do weekly when MLB season's here.
All right, now, so Dr. Morse, tell our audience where they can find you on social media, and if you have a website, let them know that as well.
Sure. So my personal, I'm predominantly on Twitter. That's my primary handle. I don't do much Instagram or anything else. It's at Dr. Jesse Morse, so DrJessEmorse. And then for the Fantasy Doctors Twitter handle, it's the Fantasy DRS on Instagram, on Twitter. And that kind of does a lot of our other stuff that I'm not responsible for.
All right, well, you heard it from him. He's Dr. Jesse Morse, MD, giving us a lot of vital information about the sports injuries, and also his podcast with the Fantasy Doctors. And Dr. Morse, thank you so much for taking time out of your busy schedule to be with us on the program.
Thank you very much.
Hey everybody, thank you so much for tuning into the channel. Remember to click like, share, and subscribe, and thank you for watching.